Hi everyone, good day. Today, we as a team would like to talk about lysergic acid diethylamide, which is shortened as LSD. So, before we dive into the topic, I would like to introduce my team members: Zaima, Saiyara, Alam, Venoshaa, Ong Wei Tat, Shu Tong, and me myself, Sarveetha Ramana. So, this is the table of the content which we would like to cover today. We will start with the introduction of the LSD, following with a chemical and pharmacological overview, primary mechanism of action, current research and clinical potential, pharmacodynamic effect on the CNS, safety, risk, and legal status, and ending with a conclusion. So let's start. What is LSD? LSD is a powerful hallucinogenic drug made from a fungus called ergot. So this LSD discovered in 1938 by scientist Albert Hofmann. LSD affects the brain serotonin system, especially the 5-HT2A receptor. It causes hallucinations, mood changes, altered thought, and a distorted sense of time and reality. Some common street names include acid, tab, and Lucy.
I'm Wei Tat, and I'll be talking about the chemical and pharmacological overview of LSD. LSD is a semi-synthetic substance derived from lysergic acid as found in the parasitic dry fungus Claviceps purpurei. The molecule consists of an indole system with a tetracyclic ring, C20H25ON3, which is the figure 1 structural formula of lysergic acid diethylamide. Carbons 5 and 8 are asymmetric in LSD, therefore, 4 isomeric optically active LSD isomers are possible and known. These are D and L-LSD and D and L-isolysergic acid diethylamide. Only the D-LSD isomer has psychoactive properties. D-LSD crystallizes from benzene in pointed prisms. It is water-soluble and its melting point is 83 degrees Celsius. LSD is usually stabilized in solution as its target salt. The molar mass of it is 323.42 gram per mole. As for the pharmacological view, a moderate dose of 75 to 150 microgram per ounce, which is by mouth, of LSD will significantly alter the state of consciousness. Alteration is characterized by a stimulation of effect, mostly experienced as euphoria, enhanced capacity for the introspection and altered psychological functioning in the direction of freudian primary processes, known otherwise as hypnagogic experience and dreams. Especially noteworthy are perceptual changes such as illusions, pseudo-hallucinations, synesthesias, and alteration of thinking and time experience. Changes of body image and ego functions also often occur. The acute psychological effects of LSD last between 6 and 10 hours, depending on the dose applied. The minimum recognizable dose of LSD in humans is about 25 microgram per ounce. The optimum dosage for a typical fully unfolded LSD reaction is estimated to be in the range of 100 to 200 micrograms. Traumatic experience called bad trips can have long-lasting effects on LSD users, including mood swings and rarely flashback phenomena. It should be noted, however, that these generally take place in uncontrolled conditions. Conversely, it has been shown that under controlled and supportive conditions, the LSD experience may have lasting positive effects on attitude and personality. Now I will pass to Venoshaa for the primary mechanism of actions of LSD.
My name is Venoshaa and I'll be talking about the primary mechanism of actions for LSD. The key pharmacological concepts that I'm going to be covering today is that LSD is a partial agonist at the 5-HT2A receptor. LSD has high affinity at serotonin receptors, which gives a long-lasting action time for almost 8 to 12 hours. 5-HT2A is the primary mediator of hallucinogenic effects. LSD is lipophilic, which means it can cross the blood-brain barrier, and how it enters the CNS is that it targets the cortisol and subcortical regions, alters sensory, mood, and cognition. About the 5-HT2A receptor agonism, the receptors are G protein coupled receptors and are found in prefrontal cortex, thalamus, and other limbic regions. When HT2A is activated, glutamate release increases, alters sensory perceptions, leading to sensory overload. Additional effects on the brain is that it disrupts the default mode of network, which means the awareness is more heightened, and it enhances cortical entropy, meaning there is a more chaotic brain activity. LSD is very low in toxicity and there is no documented deaths, although physiological toxicity should be taken in consideration, and some are acute anxiety and psychotic breaks in some individuals.
Studies exploring non-hallucinogenic doses of LSD taken regularly in tiny amounts, while popular controlled trials suggest most of the effects may come from placebo, still research is ongoing for conditions like depression and anxiety. Larger supervised doses have shown rapid and long-lasting results. In a phase 2 clinical trial by MindMed, a single 100 microgram dose led to 65% of the participants responding and 48% reaching remission from generalized anxiety disorder. Mechanistically, LSD enhances neuroplasticity, metabolic function, and dendritic growth. Organoid studies and fMRI data support this, and new analogs like JRT engineered by UC Davis are showing powerful antidepressant effects up to 100 times stronger than ketamine, which are without hallucinations or psychosis-linked activity. Another compound, SPT348, is in development to treat anxiety and depression without psychedelic effects, focusing on precision, safety, and non-hallucinogenic delivery. Advantages of using LSD in a clinical setting are that it's non-addictive, meaning it doesn't cause dependence or craving, unlike many traditional medications, and its long-lasting effects means that 1 or 2 sessions can provide relief for weeks or even months, which is a huge advantage over daily pills. So overall, LSD is gaining serious interest in science and medicine, not for recreational use, but as a powerful tool in modern psychiatric treatment.
Let's talk about the pharmacodynamic effect of LSD on CNS. Pharmacodynamic refers to how the drugs impact the body. So there are mainly three effects of LSD on CNS. The first effect is the mechanism of action. First, LSD acts as a partial agonist, meaning it partially activates the serotonin receptor, specifically the 5-HT2A. Unlike full agonists, it doesn't trigger a full response, but it is enough to disrupt the normal signaling. So the next one is the key brain targets. So these receptors are concentrated into two critical areas. One is the prefrontal cortex, which is responsible for the decision making, sensory processing, and self-awareness, and another one is the thalamus, which is our brain sensory gatekeeper. So normally the thalamus filters the irrelevant input like the background noise, but LSD jams this gate open. So the last but not least is the neurotransmitter effect. As I said, since LSD mainly affects the serotonin system, especially the 5-HT2A receptor, which leads to an hallucination and distorted sense of reality. It disrupts the sensory filtering, causes intense of chaotic perceptions. It also affects the dopamine and norepinephrine, which can increase the heuropia, emotional intensity and alertness.
Now I'm going to talk about the safety, risk, and legal status of LSD. LSD is one of the most powerful psychedelics we know. Despite its reputation, LSD is actually remarkably non-toxic. No death from recreational overdose have been reported, and its lethal dose in animal studies is extremely high, leads to a wide safety margin. So it's much safer than alcohol or even caffeine. Unlike many drugs, LSD doesn't cause a physical addiction. It doesn't hijack the brain reward system, meaning there's no withdrawal symptoms. While some users may develop a psychological dependence, and it's rare and non-comparable to traditional addiction.
But LSD isn't harmless. In high dose or uncontrolled settings, it can cause terrifying experience known as bad trips, involving fear, paranoid, or panics. People with mental health issues may be at risk for worsening symptoms. On the flip side, LSD has potential therapeutic benefits. Control studies show that small guide dose of LSD can help patients with anxiety, depression, and addictions.
And still, LSD remains illegal in most countries. In the US, it classified as a Schedule 1 drug, meaning no accept medical use. Malaysia, for example, enforced harsh penalties under the Dangerous Drug Act 1952. Some countries has changed the legal approaches for LSD. Like Australia now allows LSD for certain therapies, and Switzerland permits clinical research. LSD remains controversial due to its complex history and intense effects, but growing research shows promising therapeutic potentials and prompting a shift to its legal status.
In summary, LSD is a powerful psychedelic that profoundly alters perception, thought, and emotion through its action on serotonin receptors, especially 5-HT2A. Chemically, it's a semisynthetic compound active at microorganism levels, with the D-LSD isomer being responsible for its effects. Pharmacologically, it induces vivid sensory changes, altered time perception, and emotional shifts. Its mechanism involves partial agonism at serotonin receptors, particularly in the cortex and limbic regions, disrupting normal sensory filtering and enhancing brain connectivity. LSD's impact on the central nervous system leads to deep introspection and hallucinations by overriding the brain's normal sensory gating and stimulating multiple neurotransmitter systems. Recent clinical research has reignited interest in LSD for treating conditions like depression, PTSD, and addiction, showing potential for long-term psychological benefits even at low doses through microdosing. While LSD is non-toxic and not physically addictive, psychological risks, especially in uncontrolled settings, remain significant. Legal restrictions still apply globally, but some regions are beginning to explore its therapeutic value. Overall, LSD represents a complex but promising substance at the crossroads of neuroscience, therapy, and consciousness research.